Hi practice members, it's Dr. Dave Acosta. I hope you're having a beautiful Monday and I hope you're enjoying these videos. And today I wanted to take a moment to create a video on the low back adjustment. So the low back adjustment, there's a couple of things that I look at. Number one is I look at the leg length. I'll also look at the wear and tear of the shoes to see if there's a discrepancy in the pelvis and the leg length. I also check tone of the thigh muscles just by simply pushing there. And Erica has a little bit of tightness there. Erica, you could benefit from some quad stretches, and we can show you some of those in a little bit, okay? Mm-hmm. But I just kind of stress the leg length, check there a little bit, stretching the quads a bit. Sometimes I'll go in here and open up the hips. This is a great position to relax in and just get the hips open there, in and out. How's that feel, Erica?
Feels good.
Good. And then we'll come over to this side. Typically I go on the other side, but for the video, we'll stay on this side. Okay, and then another thing we check with the low back is the sacrum and the pelvis, okay? Those are the base for the spine. And Erica has a misalignment here on the right SI joint. This is very important to get moving because, like I said, it's the base for the spine, and we want to have a nice straight base or a straight stage so that the spine has a nice foundation. So let's go ahead and continue to assess her low back. And Erica gets adjusted a couple times a week, so she has a pretty healthy low back. So let's just correct that right side. Face me on this side, please. Okay. I really like low back. Low back has been tricky for a lot of chiropractors. When I was in school, low back adjustments could be really tricky because you've got to get the right angle, the right force. You've got to position the patient in the right way. So when you come in for your adjustment, you'll see that I'm working with angles. I'm going to work with some long levers here. So the first thing I do is bring Erica's head right into the headrest. I have her hold her elbow. We're going to bend this top leg. And then I'm going to go ahead and scoot her over towards the edge. Good. Then the next thing I'm going to do is I'm going to use the longest bone in her body, which is the femur. And I'm going to use my femur to create a long lever, and we're going to move this pelvis. Good. How'd that do? You okay there?
Yeah.
Good. And then go ahead and lay on your back, and then you get to relax the rest of the video. A couple of things that I'll check also with low back adjustments sometimes, especially for my prenatal patients. I'll come and check the anterior aspect of the pelvis there as well. You okay with that? Mm-hmm. Good. And sometimes there may be some soreness, some discrepancy in height, and that'll tell me that the low back needs some attention, that we need to actually move the low back and get the spine nice and balanced. The last thing I want to tell you is when the low back is adjusted, it creates space in between the discs and the spinal nerve roots so that the legs can get the right neurological messages, so that the blood flow to the legs can go down and then back up. Some of the symptoms are going to be tired legs, restless leg syndrome, sciatica, obviously low back pain. And then those nerves also go into these organs here, so digestive organs, reproductive organs. So sometimes it can compromise the function of those organs and those systems when the low back is out of alignment. So I hope that helps you guys. Looking forward to seeing you this week. Let's have a great May.